Duchenne muscular dystrophy. There are many types of dystrophy. One of the most commonest is duchenne muscular dystrophy. It is the most commonest and the severe form of the dystrophy. Pathogenesis or the molecular genetics of the Duchenne muscular dystrophy starts with D. That is, there is a defect in the dystrophin. The gene are deleted. It is mostly found in males, that is DAI, and they are less common. The female are carriers, whereas the male are affected. Dystrophin and the dystrophin related proteins are defect in the dystrophin associated proteins, because of which there is a defect in the muscle contraction. Clinical feature: then the children are mostly normal at the birth, but at the age of 5 years there is an weakness in the muscles, difficulty in the walking. There is an weakness in the pelvic and the shoulder girdle, and they depend on the wheelchair by the 10 to 12 years of age. It affect mostly many symptoms, many part of the body, mostly cognitive. Mostly it affect the brain, affecting the cognition. It also affect the heart, causing cardiac myopathy, and it mostly, the main cause of the death is diaphragmatic paralysis leading to the pneumonia or requires the ventilation. And there is a weakness of the muscles, its inflammation and fibrosis. The bone is also weak. The symptoms appears by the age of 5, and they needs wheelchair by the age of 12, and they don't survive at 20 years of age or death at mid 20s age. There is an presence of Goer sign, that is, they need the support of the knee and the hand for standing up, known as Goer sign. Clinical feature of them are, then the morphology of the Duchenne muscular dystrophy. It starts with D and R. The mnemonics is DR, that is, the diameter varies. Some of the muscle fiber are smaller in size, whereas the some of the muscle fiber are bigger in size. They are bigger in the size because of the regeneration. The diameter, diameter varies, and there is a degeneration of the muscle fiber, and there is a regeneration of the muscle fiber. Regeneration of the muscle fiber, or the proliferation of the endomysial connective tissue and increasement into the internal nuclei, leading to the enlargement of the muscle fiber. And they are mostly, the diagnosis of them is through the laboratory elevation of serum creatine kinases. And in microscopy there is a replacement of the muscles by fat and the connective tissue. In heart there is an fibrosis, and biochemical investigation or the laboratory investigation, there is an increasement in the serum creatine kinases. In the muscle biopsy we can see the microscopic features. There is an atrophy and hypertrophy of the muscle fibers. And another type of the dystrophy is Becker's muscular dystrophy. This is similar like that of Duchenne muscular dystrophy, but it is less common and less severe. It onset in the later childhood, slowly onset, variable rate of progression, similar, and all are similar as that of Duchenne muscular dystrophy, except that it is less severe.